Hello everyone, and welcome back to PediaTime, your channel for mastering pediatrics. If you're new here, hit that subscribe button because we're covering high-yield topics for your exams and clinical practice. In this video, we're covering Fragile X syndrome, the most common inherited cause of intellectual disability. Molecular genetics. Fragile X is caused by CGG trinucleotide repeat expansion in the FMR1 gene on XQ27.3. Here's what matters. Normal individuals have 5 to 44 repeats. Premutation is 55 to 200 repeats. These carriers are clinically normal, but the mutation is unstable. During maternal transmission, premutations expand to full mutations. That's over 200 repeats. This causes gene hypermethylation and loss of FMRP protein. FMRP is an RNA-binding protein essential for synaptic plasticity and dendritic spine maturation. Without it, you get abnormal brain development and the clinical features we see. Clinical features in males. Males are more severely affected. Intellectual disability ranges from borderline IQ of 70 to severe impairment below 40. Speech delays are prominent with echolalia and preservative speech. Facial features become obvious with age. Long, narrow face, prominent forehead, large protruding ears, high-arched palate, and prognathism. Post-puberty, 80% develop macroorchitis, testicular volume over 30 milliliters. This is pathognomonic. Behaviorally, 30 to 50% meet autism spectrum criteria, making Fragile X the most common single-gene cause of autism. Look for hand flapping, hand biting, gaze aversion, tactile defensiveness, and severe social anxiety. ADHD occurs in 70 to 80%. Females. About 50% have intellectual disability, usually milder than males, due to X inactivation. The other 50% may have learning disabilities or anxiety or be asymptomatic. Premutation carriers. Males with premutations can develop FXTAS after age 50, Fragile X-associated tremor ataxia syndrome, with intention tremor, ataxia, cognitive decline, and the MCP sign on MRI. Female premutation carriers get FXPOI, premature ovarian insufficiency before age 40 in 20% of cases. Diagnosis. Screen any child with unexplained developmental delay, intellectual disability, autism, or family history of these conditions. Also consider it in women with premature menopause or older men with tremor ataxia. The diagnostic test is molecular genetic analysis. PCR detects CGG repeat number. Southern blot confirms methylation. The old fragile site karyotype is obsolete. Don't use it. Prenatal diagnosis via CVS or amniocentesis is available. Associated complications. Seizures in 15 to 20%, usually complex partial or generalized. Mitral valve prolapse in 50 to 80% of adults. Get baseline echo. Strabismus in 30 to 50%. Recurrent otitis media. Screen for sleep apnea. Joint hyperlaxity and scoliosis from connective tissue involvement. Management. No cure. Treatment is symptomatic and multidisciplinary. Early intervention is critical. Speech therapy, occupational therapy, special education, and applied behavior analysis. For ADHD, which affects 70 to 80%, use stimulants like methylphenidate first line. Alpha-2 agonists like guanfacine are alternatives. For anxiety, try SSRIs like sertraline. For severe aggression, atypical antipsychotics like risperidone may be needed, but use cautiously. Monitor medical complications, baseline and periodic echocardiograms, annual vision and hearing screens, and EEG if seizure concerns. Genetic counseling. Carrier mothers have 50% risk each pregnancy. Premutations expand to full mutations during maternal transmission. This is anticipation. Offer cascade testing to family members. Discuss prenatal diagnosis, preimplantation genetic diagnosis, or other reproductive options. Prognosis. Normal lifespan. Functional outcomes vary widely. Some live independently with support, others need lifelong care. Early intervention significantly improves outcomes. Key exam points to remember. Most common inherited intellectual disability, X-linked dominant, CGG repeats over 200, loss of FMRP, males severely affected, intellectual disability, long face, large ears, macroorchitis, autism features. Females 50% affected. Premutation carriers get FXTAS or FXPOI. Diagnose with molecular testing, manage with early intervention and symptomatic treatment. That's Fragile X syndrome. If this was helpful, smash that like button and share with your study group. Subscribe to PediaTime. It's time to learn pediatrics. Comment your questions below and tell me what topic to cover next. See you in the next video. Happy studying!